Now we will discuss about the elastin. Overview, molecular structure and composition, cross-linking and elastic properties of elastin. Elastin overview. Elastin, it is an elastic protein that allows tissues to stretch and recoil. So basically, elastin, it is a protein that allows tissues to stretch and recoil in the body. Location. Where is elastin located? It is abundant in the skin, lungs, large arteries, elastic ligaments, vocal cords, epiglottis, and ligamenta flava. What is ligamenta flava? Ligamenta flava, it connects vertebrae with one another. So what is function of elastin? Elastin provides elasticity and resilience to tissues that undergo repeated deformation. So its main function is, elastin provides elasticity and resilience or support to the tissues that undergo repeated deformations. So now we will discuss about the molecular structure and composition. Molecular structure and composition of elastin. So tropoelastin. So it is tropoelastin it is a precursor. Like what is precursor? Like it is building block of elastin, or it comes before it. It is soluble precursor. Tropoelastin, it is a soluble precursor that is secreted by the cells. So it assembles on a scaffold and is then cross-linked to form mature elastin. So tropoelastin is major component of the elastin itself. So and tropoelastin cross-linked to one another and assemble to form mature elastin. Amino acid profile. What is the amino acid profile of elastin? Because elastin is a protein, so protein are made up of amino acids. So now we will discuss about the amino acid profile of elastin. So it is rich in non-hydroxylated proline, glycine and lysine. So non-hydroxylated, there is no OH group. So it is mainly composed of proline, glycine and lysine. So these are rich. So elastin is rich in non-hydroxylated proline, glycine and lysine. So it is different from collagen. So why it is different from collagen? Collagen contains hydroxylated proline and lysine. So elastin contains non-hydroxylated proline and lysine, and collagen contains hydroxylated, where OH group is positive or it is present. So collagen contains hydroxylated proline and lysine. Conformation. Elastin molecules adopt relaxed and stretched conformations to permit reversible extension. Cross-linking and elastic properties of elastin. So cross-linking enzyme. Lysyl oxidase catalyzes covalent cross-links between lysine residues extracellularly. Result: cross-linking converts tropoelastin into insoluble durable elastin, and it is essential for elastic recoil. So cross-linking converts tropoelastin into insoluble durable elastin. So elastin is essential for recoil and stretching. Degradation and regulation. Elastase, protease that degrades elastin. So elastase it degrades elastin. So now we have discussed that elastin is stretchable protein and it is essential for recoil. So elastase, it is a protease that degrades this elastin. Alpha 1 antitrypsin. Alpha 1 antitrypsin. Alpha 1 antitrypsin is also a protease inhibitor that inhibit elastase and protect tissues, especially in the lungs. Alpha 1 antitrypsin deficiency. Unopposed elastase activity, destruction of alveolar elastin, that is destruction of alveolar elastin that leads to COPD and emphysema. So basically alpha 1 antitrypsin deficiency leads to unopposed elastase activity. So when elastase activity is unopposed, it degrades elastin that leads to destruction of alveolar elastin. Alveoli are present in the lung. So when destruction of alveolar elastin takes place, so COPD, it causes COPD and emphysema. Fibrillin and TGF beta interaction. Fibrillin 1. What is fibrillin 1? It is an extracellular glycoprotein that forms scaffold sheath around elastin fibers. It forms scaffold sheath around the elastic fiber. Fibrillin 1, it is an extracellular glycoprotein. Its role is it organizes elastic fibers assembly. It sequesters TGF beta, then regulating growth factor availability and connective tissue homeostasis. Defects in fibrillin affect both structural integrity and signaling. Defects in fibrillin. When defects happen in fibrillin, it affects both structural integrity and signaling. Now we will discuss about the Marfan syndrome. Marfan syndrome, it causes mutation in FBN1 gene on the chromosome 15. So mutation in FBN1 gene on the chromosome 15. Inheritance. Marfan syndrome is autosomal dominant with variable expression. Pathophysiology. Its pathophysiology is defective fibrillin 1 leads to abnormal elastic fiber structure that alter TGF beta regulation. Key clinical features. Key clinical features of Marfan syndrome are tall stature with long extremities and arachnodactyly. What is arachnodactyly? It is long tapering fingers or toes. Marfan syndrome it has a feature of chest wall deformities such as pectus carinatum or pectus excavatum, where chest is pectus carinatum or pectus excavatum. These are basically chest abnormalities where chest is pectus carinatum and pectus excavatum. These are chest abnormalities. And hypermobile joints. So there are some cardiovascular impacts like cystic medial degeneration of the aorta, aortic root aneurysm, dissection or rupture, that is major cause of death, mitral valve prolapse, increased risk of spontaneous pneumothorax. Variable expression means severity and specific signs that differ between the patients. Homocystinuria. Homocystinuria causes most commonly cystathionine synthase deficiency. Most commonly cystathionine synthase deficiency, it leads to homocystinuria. Accumulation of homocysteine, that leads to accumulation of homocysteine. Its inheritance is autosomal recessive. Homocystinuria is autosomal recessive disorder. Clinical features that overlap with Marfan. So clinical feature of homocystinuria are tall stature, arachnodactyly. Arachnodactyly is long tapering fingers or toes. Pectus deformity. Pectus deformities like chest chest deformities in chest, joint laxity, scoliosis. Scoliosis is basically defect in the vertebral column, skin hyperelasticity, distinction feature. So these features are different from Marfan syndrome, intellectual disability or decreased cognitive function, increased risk of thrombosis, vascular complications, lens dislocation typically downward and nasal, opposite direction to Marfan. Body proportion, increased arm span height ratio, decreased upper lower body segment ratio, often fair complexion compared with Marfan. So fair complexion, its meaning is skin is normal. So there are no defects in the skin. So skin is normal. So in homocystinuria, complexion is fair, and as compared to Marfan syndrome, where there are some defects in the skin also. How to differentiate Marfan syndrome and homocystinuria? So inheritance. Marfan syndrome, it is autosomal dominant. So Marfan is like man and it is dominant, autosomal dominant. And homocystinuria, so it is autosomal recessive. Homocystinuria is autosomal recessive. Marfan syndrome is autosomal dominant. Cognition. Marfan syndrome, normal intellect, and in homocystinuria, decreased intellect is common. Vascular risk. In Marfan syndrome, aortic root dilatation and dissection takes place, and in homocystinuria, there is increased risk of thrombosis. Lens dislocation direction in homocystinuria and in the Marfan syndrome. In the Marfan syndrome, upward and temporal lens dislocation, upward or temporal. In the homocystinuria, downward and nasal dislocation of the lens. Now we will discuss about the key terms used in our lecture. Tropoelastin, lysyl oxidase, elastase, alpha-1 antitrypsin, fibrillin 1, cystathionine synthase deficiency. So what is tropoelastin? Tropoelastin is soluble elastin precursor that polymerizes and cross-links to form elastin. So basically it is building block of elastin. Tropoelastin is building block of elastin. So tropoelastin is building block of elastin. They combine together to form elastin. They cross-link and polymerize to form lysyl oxidase. So what is lysyl oxidase? It is enzyme that forms covalent cross-link between lysine residues in elastin and collagen. So it covalent cross-link between lysine and lysine residues in elastin and in collagen. It cross-links lysyl oxidase enzyme. So elastase. So what is elastase? It is also enzyme that degrades elastin. So what degrades elastin or break elastin? So its name is elastase. It is enzyme that degrades elastin. Alpha-1 antitrypsin. So alpha-1 antitrypsin. It is inhibitor of elastase. So it stop elastase for the degradation of elastin. and protects lung tissue. Okay, so elastase is basically degrades elastin that is very harmful for lung tissue, because elastin is located in the lung tissue. And alpha 1 antitrypsin, what it does, it inhibit elastase to degrade elastin and then protect lung tissues. Fibrillin 1, what is fibrillin 1? It's scaffold glycoprotein for elastic fibers. It binds and sequesters TGF beta. So it scaffold the glycoprotein for the elastic fibers, and it sequesters TGF beta. Cystathionine synthase. Cystathionine synthase, it is also an enzyme in methionine metabolism. Deficiency of cystathionine synthase causes homocystinuria. Deficiency of cystathionine synthase causes homocystinuria.